Let's get started. Okay. Call to order. 5:31. Kathy, can we have a roll call? I think. Well, let's see. Supervisor Franco is present. Supervisor Kirby's present. Supervisor Brown is excused. Supervisor Nez is present. Supervisor Nordigian is present. Supervisor Poole is present, and Supervisor Robinson is present. As far as youth and governance is concerned, JJ Castro is absent at the moment. Olivia Parrish is excused. Aksasad Kadri is present, and Sriharsha Siddhamaraju is absent. Okay. All right. So a few things before we get started. We will be voting as a combined committee, Human Services Committee in conjunction with Human Services Board. And so keep that in mind. Also, any citizen comments, they are for 3 minutes. Okay. And over there is where if you have a citizen comment, you can make your comments over there at the lectern. I just have a few things to say before we get started. First of all, I'd like to thank John Jansen and Rebecca Dutter and those who are responsible for the food today. Thank you this evening. Thank you very much. It's very nice of you. I'd also like to recognize Tammy Capito and her team for the departmental budget. The divisional summaries are are very thorough, very clear, and very user-friendly. Moreover, they complement the budget really well, especially with the page references. It's much appreciated, so thank you very much. Lastly, tonight we will review each divisional budget as per the agenda, and we'll just go through and we'll vote on each individual budget. I find that the easiest and most efficient way of dealing with their, proceeding. So that's the way we're going to do. And let's see, I think that's about it as far as my comments. Do any of the committee members or board members have any comments that they would like to make before we get started? We good? Okay, very good.
Jim,
Yes, sir.
I'd just like to acknowledge your luncheon tonight is made up by Brookside Care Center.
Oh, thank you. Okay.
Everybody enjoys the luncheon, and we appreciate your support.
I wasn't privy as to where it came from, but thank you for correcting. Appreciate that. Thank you very much. Okay, are there any citizen comments this evening? Any citizen comments? If so, we go to the lectern. Any citizen comments? Doesn't look like we have any citizen comments. Okay, citizen comments are closed. So let's get to the presentation and approval of the 2025 Department of Human Services budget. And so Tammy, take it away. You can start with the DHS overview, and we'll just go through each division and vote on them as accorded. You have or John, you want to say a few words?
Just a quick reminder that if you are going to have a question, please turn on your mics because it is being recorded. Thank you.
Yeah. Turn on your mics when you speak, and also when you're not speaking, you can turn them off. But just remember to turn them on and make sure you're speaking directly into the mic for the benefit of the recording as well as for all those who are here tonight. Thanks for the reminder. Tammy, take it away.
So a couple things, we do on the booklet, we do reference the budget book. It is online on the Croton County website. We also have supplemental pages in the back that do give all the details. I will be going through the summary pages as I did last year. In 2024, we did split off behavioral health into its own division. So you'll see some things in the budget that is just interdivisional, like it affects one division, but us as a whole is still a zero levy impact. The backup for that sheet is the last page in the booklet as well to show all the differences between divisions. All right, with that, we'll start with the Human Services overview. So for 2025, DHS is at this point looking for a levy increase of just under 1.3 million or 6.1%. Of this increase, or I'm sorry, of the funding, we have 43, almost 44% in federal funding, 23% in state funding, and 2% in grants. So of our total budget, we've got a levy percentage of 19.5%. Our county FTEs, we're looking for an increase of 7.4 FTEs. And our personnel increase, including these FTEs and annual wages, is just under 3 million. So with that, we will start the presentation. We'll start with the Brookside Division. So the Brookside Care Center in the budget book is pages 235 to 245. Also in the Human Services budget book, there are supplementary pages that start on page 15 to 20. This budget was unanimously approved by the Board of Trustees on October 14th. So the key items, their staff and retention is an increase of 352,000. 236,000 of that is an annual increase, including benefits. We are requesting a 1.0 nursing office manager. That's for 75,000. We have a reclass of CNAs to CMAs, 4.0 of them for 4,200. We have an increase for staff development and leadership of 15,000. They are implementing a STAR program, staff thankfulness and recognition. That's an increase of 10,000. We have an environmental services support manager from an E5 to an E6, $31. We have a life enrichment manager moved up from an EO5 to an E6, $3,200. And the custodians from an NEO6 to maintenance workers, NEO7, $7,400. For the census for Brookside, so last year we went to a long-term care model and moved some of our short-term beds into long-term care, which has created a lot more stability in our census numbers. And with that, we are increasing our census from what we adopted for 24, 128, up to 136. Currently today, we're at 143. Our private pay census is increasing from 35 to 44. And that's an increase of 1.3 million. Our managed care, we have a decrease from 7 to 6. Our third shift RN supervisor, we defunded that last year. We are putting those funds in now to go with the increased census. We have temporary maintenance for the summer season for 16,000. We had some CNAs that were defunded with the lower census. We have put that funding back in. That's 19.2 CNAs. And then we have an overtime increase, 136,000. The next initiative is to sustain and maintain financial independence. Our private pay rate, we have increased from $400 a day to $415 a day. Managed care, we have the rate decreased from $450 to $430 a day. Our Medicaid rate has increased from $392 a day to $420 a day. We now have the HR business partner in our budget, and we have increased our Medicare B revenue based on projections. As you may remember, our dietary staff, we have contracted out with Unidyne, who has provided the food for you tonight. They, as people leave the county staff, we then acquire them through that contract. So we had a 0.2 FTE leave county staff, and then that will be acquired then through the Unidyne contract. We also have some dietary food costs increase, 56,000. Contract maintenance increase of 37,000. Housekeeping supplies, 10,000. Utilities, 16,000. And incontinence supplies, 25,000. We are also proposing in the budget, $50,000 to put together a strategic plan for the long care facility. And then we have bonding. It's a decrease from last year of 385,000. Go to page 18 in your books is where the bonding and capital detail is. The first section is operating revenues. We have miscellaneous replacement, which we have in there every year of 5,500. We are increasing for a vital machine, 3,000. Laundry carts and covers for 4,560. These are all coming out of operating revenues. Housekeeping carts for 9,000. Then the bonding section, the last column to the right. We are bonding for residential facility, furniture and equipment. We have that in there every year. That's for 41,000. And then request for 12 rehab adjustable beds for 24,000. We also have a standing item in there, replace doors, windows, sinks, and flooring. We replace them as needed. And this from the old part of the building when we got it renovated. Those are the items that did not get renovated. And then we also have the kitchen floor that needs replacing, and that's 105,000. And then back to the Brookside page, number 8, the days in the year from 366 to 365. They charge a daily rate. So when that changed, that obviously brought our revenue down 61,000. Brookside Care Center, as we have proposed, is adding to the reserves 396,000. Questions on Brookside?
Thank you. My question is what's different from last year that the 385,000 less in the bonding? I mean, what are the type of things? I'm new to the Human Services Board here, so I just informational, that's all.
Yeah, last year they had added 200,000 for the generator, and they had 100,000 in for the roof replacement. So they added 100,000 to the roof.
Okay, thank you.
Tammy, what was the, I'm looking at the budget book, the projected end of year expenses, or I'm sorry, revenue. It seemed like it's going to exceed the expenses at the end of the year by a couple million. What was it accounted from? Where does that money come from?
You're talking for 2024?
Yeah, right.
Yes, so we received a lot of Medicaid rate increases.
Yeah,
So
okay.
Medicaid's gone to a PDPM rate. And so we've received, it's really covering the cost of care with the state budget.
And that accounts for the revenue increase, but also private pay, the rate, does that help? Does that have something to do with it too, or what?
Private pay, we are losing a little bit in private pay. So those financial statements that get sent out monthly, there's a per day analysis in there.
Mm-hmm.
And private pay, I know it's under $10 we're losing per day, but as our census increase, our fixed costs get spread amongst more revenue. So it's really starting to equalize. The $415 a day will definitely cover the cost.
Yeah, well, it's good to see that that we're having a surplus there. That's going to be proved very helpful for next year, no doubt. Yeah, thank you.
Sure.
I had another question, just had to do with the facility itself. What would be considered completely filled,
154 beds.
154 beds? Well, you got close, honey.
Yes.
Okay. Looking for the future. Thank you.
How we doing on the CNAs?
I believe we're doing well. I'll let Linda talk on that one.
We're definitely doing better. I would say second shift is a little bit of a struggle. But that's not abnormal in any 24-hour entity. But yes, that's why our census is able to increase like it is, and every floor of the building is open. In fact, our census with the admissions today is 146, and we have 154 bed capacity. So that tells you that we do have enough staff to take care of the residents that we currently have, but we are looking to maybe take from pool to make them more of an FTE, but it's the industry kind of thing.
Thank you. Any other questions on Brookside? Anything? No questions for Tammy? Have a seat, JP. Okay, nothing from the board, no questions? Okay, as I said, if we're done with this particular divisional budget, we can, someone want to make a motion to approve the budget?
Move to approve.
Okay, we have Supervisor Nardigian. Do I have a second? Second by Supervisor Robinson. Youth and Governance, how do you vote?
Aye.
Committee?
Aye.
Aye. Sounds unanimous to me. Any opposed? No one's opposed? Okay, so the motion for the Brookside divisional budget passes. Okay,
Right, so the next division is the Willowbrook Assisted Living. It's on page 3. In this one, we are budgeting to add to the reserves 24,000. And of that, we have a annual increase, including benefits, increase of 36,000. Medical insurance increase, the cost of medical insurance has not gone up. It's just the, how many people are taking it and family versus single. That was an increase in their budget of 70,000. We have an overtime decrease of 9,000. We are requesting to add a resident engagement assistant at NE3 for 15,000 and a 0.2 environmental services worker, NE4 at 8,600. In this budget, we are looking to increase the rates 7%. That would be an increase in revenue, 127,000. And we also have the HR business partner allocation in here for 13,000. We have food cost increase for 15,000. And then for capital bonding, they do have some courtyard automatic doors that are very hard for the residents to open, and we have that in bonding for 16,000. This budget as well was approved unanimously by the Board of Trustees on October 14th. Any questions on Willowbrook?
any questions from the committee or the board? Yeah, this one looks pretty straightforward to me too. Do I have a motion to approve?
Move to approve.
Move to approve by Supervisor Nordigian. Do I have a second?
I'll second.
Second by Supervisor Nez. Youth and Governance, how do you vote?
Aye. Aye.
Committee? Aye. Motion for the divisional budget passes.
Okay, the next section is the Office of the Director. It's on page 4. Overall, for this division, we are looking for an increase of 29,000. We have the annual increase, including benefits, increase of 23,000. Staff development increase of 1,000. We have, state and federal funding that we're able to draw down for the increases of 8,281. In 2024, we had added a Human Services Quality Analyst Manager, that's a 1.0, and we had ended our planning and evaluation services, that was a contract. The net of that in our 2025 budget is 11,842. Our public liability insurance allocation was an increase of 1,100, and our building rental was a decrease of $209. And then questions on the office of the director.
Tammy, what falls under cost allocation?
For the revenue.
Yeah,
So we get, we charge out indirect costs to our other funding sources. Some of our funding sources are maxed out. They're capped at a certain amount. We have a few funding sources that do not get maxed out. Child support being one of them, we get 50 cents on the dollar. Income maintenance, we get 67 cents on the dollar. So there's some funding sources that we can draw down, administrative costs.
yeah, because the reason I asked is I had in my notes here that for 2023, it was 4.2 million and nothing for 2024. Am I correct on that?
That does not sound correct.
Okay, something else. Right. I see that.
I can say that.
Subject director, I'm on the right spot. I'm just trying to find what I saw. Yeah, yeah, it says on page, thank you, 167, and actual cost allocation, 4,227,921, and all across the board, it's zero, and well, for proposed zero for 2025. I'm just curious what that has to do with, or how that is accounted for. It's in our budget, obviously not what it's given. No idea.
I'll have to look at that to see if there's some kind of error. That doesn't sound correct.
You want to show this to you? I thought it was a little strange myself. You notice here. I mean, it's probably here or there because it's 2023 budget. I just thought it was odd that there were zeros all the way across the number here.
Yeah, I'd have to look at that year, see what happened in that year.
Okay.
It might be something that maybe we had actual budget for.
But for 2025, it was zero for cost allocation. Okay, all right, thank you. Yeah, well, that's good. Any other questions for the Office of Director? Questions? Oh, no? Okay, well, do I have a motion to approve?
I move to approve.
There's a motion on the floor, approved by Supervisor Nez. Do I have a second?
Second.
Second by Supervisor Nordigian. Youth and Governance, what say you?
Aye.
Aye, okay. Committee, how do you vote? Aye. Anyone opposed? Motion for the Office of the Director budget passes.
Children and Family Services. That is on page 5, the next page. For this division, we are looking for a increase in levy of 864,000 or 8.5%. We have annual increase, including benefits, 185,000. We are requesting a social worker supervisor to start mid-year. So that's the 0.5 FTE at 62,000. This position we're looking at to help prevent out-of-home placements and reduce the length of time out of home. For funding changes, we have a decrease in collections, 230,000. A decrease in the children's long-term support foster care program, 150,000. Medicaid case management, a decrease of 65,000. We have the Families First grant increase for in-home safety checks. You'll see an increase in revenue and expense for 69,000.
Tammy, 1 second, sorry to interrupt. I'm trying to find the budget. It says 171, but I'm not seeing it on there.
7177.
That's the children DCFS budget.
Yeah.
Ah, there it is. Okay, and it finishes on 177. Go ahead.
We have CCS revenue increase 65,000 and a youth aids revenue increase of 62,000. Here is where we have the start of some of the behavioral health division split. That has changed between divisions. Like I said, it's on the last page in the book that will balance it all out. We have the adult comprehensive community services program that's been moved to the behavioral health division. The juvenile institutes have been moved to the behavioral health division, and some savings from the planning and evaluation contracted services that we ended. We have court ordered placements, an increase of 279,000. And if you go to the next page, that will show our placements graph on what we have budgeted from 24 to 25. You can see that when there's rate changes, what the rates are from 24 to 25, and then also the number of kids in placement. So number of kids in placement, you'll see we went from 422 in the 2024 budget up to 436 in the 2025 budget. And also see what the cost is for each placement for one youth for 1 year. So the rates in this placement budget, we do have the Racine ACE program going away. It's alternative to corrections. There are some other counties that still have this program that we could place them in, and they are opening up a youth development facility, which would be corrections. So we have a couple of changes going on with that change, with the state wanting to close Lincoln Hills. Any questions on the placement graph? Okay, then we'll go back to the summary page. Page 5. Section 5, the program changes. We are removing a PSN nurse. Currently, we are referring anybody who needs those services now to the health clinic. That's a reduction of 60,000. We are removing the community intervention youth coordinator. That's a reduction of just under 73,000. We are removing the Jefferson after school program. That's a reduction of 74,000. We have a youth innovation grant we talked about in the 24 budget adoption. It's a county-wide truancy program. That's 75,000 in revenue and 75,000 in expense. We have increased our child protective services after hours, 61,000. And we have, we're requesting an additional school liaison for truancy with the support of KUSD. So this is dependent on KUSD funding 40,000 of it. And that is because there's only one school that wouldn't have one. So this would be to have the school that doesn't have one with all the other schools closing to have that position in there. Then we have an increase in mileage and staff development, just under 24,000. We have some increased contracted costs $49,000 for the answering message center and clerical support, for increased insurance costs. This is for a nonprofit provider that we pay actual cost. And then we have the contracted fiscal services. We have $38,500. That's just a transfer from the finance budget into DCFS's budget. And then the rest is a $22,000 increase. And that would be everything for DCFS.
Questions? Supervisor Robinson?
Yes, just a question for the social worker supervisor, the half-time or the half FTE. Does that mean that in 26, we will be looking at a 1.0 FTE?
Yeah, so 26, it'll look like an increase of about 0.5 again, but then it would be to a 1.0. Yes.
Thank you.
Supervisor Kirby and then Supervisor Poole.
So for the Jefferson After School Program, those students all moved to a different school. Do they have something that replaces that at their new schools?
So this, we don't have, this was the only school we had an after-school program for. So it's not something, I don't know where it started from, but with that school closing, now we just don't have it anymore. But the other schools do not have an after-school program that we fund.
Okay.
Supervisor Poole?
Yeah, I had a question on number 7, under contracted clerical support and answering for the messaging center. I mean, 49,000 sounds like a heck of an increase there.
It's a 8% increase. It was from 585,000 to 632,000. So they actually had increases in their medical insurance last year that we did not cover. So it's really kind of catching up from last year as well. But yes, the medical insurance has an increase.
So is that just a evenings and weekend answering service?
No, it's throughout the week. And, you know, there's other support besides the answering message center.
Okay, thank you.
Yeah, Supervisor Deegan?
Thank you, Mr. Chair. The under number 5 program changes is remove PSN nurse and remove community intervention youth coordinator. Those are not FTEs.
The PSN nurse was out of the health budget. So the health division had that position. You'll see a reduction in theirs for that FTE.
Okay.
The community intervention youth coordinator, that was through the Boys and Girls Club. So that
I'm sorry, that was where, through
through
where?
Boys and Girls Club. So
Okay,
that is not an FTE nurse.
Okay, thank you.
Considering the DCF services budget, divisional budget is the biggest in human services. It's nice to see that expenses are going down. I was wondering, and that largely because of the out of home placement costs, which is largely out of our control because much of it is rates determined by the state. I understand that. I noticed that the revenue for the reporting unit went down a bit. Can you address that? I noticed, for instance, CCS adult revenue was 0 for projected this year. Can you maybe talk to that a little bit?
Yes, so that is with the behavioral health split. So when we split out behavioral health into its own division, they are going to get the community comprehensive services expense and revenue. So that was 2 million moved over there.
2.7 actually, or was that 2.7 million?
I have 2 million in my numbers
I'm looking, okay,
under section 3.
okay. I'm looking at the end of the year 2023. That's what I was looking at.
Oh. So from 24 to 25, it's 2 million that got moved over to behavioral health.
Okay, thank you. Any other questions? Any other questions, comments? Do I have a motion to approve?
I move to approve.
Okay, that's a motion by Supervisor Curry, second.
Second.
second by Supervisor Robinson. Youth and Governance, how do you vote?
Aye.
Committee? Aye. Any opposed? Motion carries for the passing of the DCFS divisional budget.
So the next division is the Division of Workforce Development. Starts on page 179 in the budget book. For this division, we have a decrease in levy of 125,000. In the annual increase, including benefits, was an increase of just under 50,000, but also an increase of revenue of 33,000. This one, we're looking for a pay structure change in the, from a regular ESS worker to a senior after a certain amount of time, which added to our expense $2,000, but we get 50 cents on the dollar for that revenue. So the funding or the revenue also increased 1,000. And that was just to help with retention of our employees. So they would get a bump up after their longevity of a certain amount of time, which I believe is 3 years. Funding changes, we had some cleanup in the accounts, I'm gonna call. So overall, it was a decrease of 59,000. But you'll see the income maintenance to align the revenue to expense increased that revenue line 340,000. But the offset is the child support decrease of 254,000. And then our elevate revenue adjusted to actuals was a decrease of 27,000. So overall, with all of those reclasses and changes to clean up those accounts, we did have a decrease of 58,000 based on our projections. We have a workload coordinator that we split with Racine County. That's an increase in expense of 45,000 with a revenue increase of 22,500. We have the contractor cost increase of 28,000. We have some reduction in the shares grants, 105,000. 50,000 of that was with ARPA funding that's no longer there. And then we have a reduction in building our futures of 75,000. The liability insurance allocation was a reduction of 25,000. And our building rental with the split of behavioral health services has decreased for workforce development 58,000. And that would be it for workforce development. Any questions?
Supervisor Kirby?
So what is driving the, actually I have two questions. So what is driving this contractor cost increase? What are we spending that on?
This is the same one. This is for our Goodwill contracts. So all of these that you'll see, that is the Goodwill, the medical insurance for the Goodwill.
Okay.
They have currently in their budget, in this one, it was a 2.47% increase. We have a 1.1 million, 1.123 million to 1.151 million.
Okay, so it's an allocation.
Yeah.
And then what's the reduction for building our futures?
So we had 100,000 in there. It was reduced in 2024 to 50,000. Now it's being reduced to 25,000. It's to help make our numbers, you know, we had a reduction in levy and it's something that would have a minimal effect on our programs.
Okay, I know they, at least in my neighborhood, they do like they're working on a walking school bus program. So that I'm a little concerned to see a reduction in that, considering that the need is a lot greater.
Any other questions?
Other questions?
Move to approve.
Motion by Supervisor Nordigian. Do I have a second?
I'll second.
Second by Supervisor Nez. Youth and Governance,
Aye.
Committee? Aye. Any opposed? Motion carries for the acceptance of the Workforce Development Divisional budget.
All right, our next section is the central services budget. It's found on page 187 in the budget book. So central services is split into two sections. One is this building, which does get charged out to we have some people that rent from space in here, and then it also gets charged out to the divisions. So it's a net effect to the levy of 0 in this section. And then we also have the county-wide mail services that are done downtown. That is the levy portion of this section. So for the job center building costs, we had the contractor increases, 9,700, which then gets charged out to the renters. And then we had the mail room services. That was an increase of 1,561. And that is it for central services.
Any questions?
Move to approve.
That's a motion by Supervisor Poole. Is there a second?
I'll second.
Second by Supervisor Kirby. Youth and Governance, how do you vote?
Aye.
Committee? Aye. Any opposed? Motion carries for the acceptance of Central Services Divisional budget.
All right, the next division is the Office of the Medical Examiner. That's on page 193 in the big budget book. For this division, we are looking for an increase of just under $3,000. The annual increase, including benefits, was just under $43,000. This one, we are looking for a medical deputy pay structure increase for $36,000. Right now, the part-time deputies, when they're on call, they get paid a guaranteed 1 hour if they have less than a 12-hour on-call shift, and they get a guaranteed 2 hours pay if it's over a 12-hour shift. This would increase that pay to 2 hours guaranteed pay under 12 hours and 4 hours over 12 hours. And this would be the same as juvenile court intake. That is how they have their on-time structured as well. We are also looking to add $10,000 in bonding. So last year we had $55,000 in there to replace a 2012 Chevy cargo van. We would like to add $10,000 to that for the retrofitting. We have decreased the budgeted autopsies from 157 to 130, and the pediatric from 4 to 2. That's a decrease in expenses of $38,000. And we have increased the fee revenue by the Consumer Price Index. And you would find the revenue on page 33 in your supplemental pages, and that is for $39,000. Questions on the medical examiner?
I have a question.
Supervisor Nordigian?
Thank you, Chair. Number 4, increased fee revenue by Consumer Price Index increase. Is this just an automatic thing? Annually, this is just what happens?
Yeah, so the state allows us to annually increase by the Consumer Price Index.
When the Consumer Price Index goes down?
Well, we haven't had that yet. But I don't
I'm really hoping it does. Prices down, but, so the maximum you can increase is as high as Consumer Price Index.
Correct. I think they were having issues with many different departments just charging a lot, and they limited it to that. So,
Okay.
yeah.
Okay. And have we traditionally just done it?
Not increased it?
No, I mean, have we traditionally done the Consumer Price Index every year?
Yes.
Okay. And then, to go to number 2 in the Chevy cargo van. So, this year's budget, 2024 budget was the purchase of the van. I don't know if we purchased it
We have
yet.
not.
So the additional $10,000 then would be to outfit it with the proper. Is there a reason why we haven't purchased the van?
Yes, we have not purchased it. We're waiting for costs to come down. And it's not the cost of the van that is high, it's the government discount. The government discount is very low right now. And, you know, we want it in the budget, so if we get into where it just breaks down, we have to replace it, we have the funding in there. But if we can hold off until that government discount increases back, we would like to hold off, be fiscally responsible.
Is there indication that they're going to increase?
I'm just hoping.
Might be waiting for a while.
But now with the extra 10,000, we have enough to cover if there is something where we have to purchase it.
Yeah, I don't know enough about the government discounting high, low, when it's gonna happen, but, I think we had a president what says, you know, be careful, you know, that, anyone that says, hi, I'm from the government, I'm here to help. Maybe we ought to move forward with it, but I know that's the board, you know, the board's decision to do that, but, or your staff, but I just think waiting might be even worse.
Well, we have 2 vans, just so you know. So
Sure,
we have one that we just replaced, so
Mhm.
we're, you know, we have a
Okay,
back.
well, I mean, again, we know things don't go down in price, right?
Yeah.
That's why the consumer price index was. Okay, thank you.
What was the tax credit, just out of curiosity, from the government?
Well, I can say, I think it was like 15,000. Don't quote me on that, but the last time we bought the van with the government discount, it ended up being like 36,000. And now we have 65,000 in there for it. So it was significant.
Got a question on number 3. Why are the autopsies going down? Are drug tests leveling out or going down, or what?
Yeah, so right now we're projecting to be at 108 if we were to straight line it. But yes, the autopsies, this is still being conservative. It can ebb and flow. But, yeah, right now if we were to straight line where we're at right now, we'd be at 108. So we're not going down to where we're at now because we've been up many years and we've been down many years. So do you want a more detailed answer? Because Patty's begging to.
Hi, everybody.
Patty,
So our autopsy numbers have actually gone down significantly, and that is not just with our county, that is a nationwide trend that we are seeing. And the reason behind that is because there has been a significant decrease in the number of overdose deaths, not just here, but across the nation. There was just an article that just came out from NPR, I think on the 9th, a couple weeks ago, that came out. And even with our county right now, we are at 23 confirmed toxicity deaths for the year. And it's just significantly declined. So it's a positive thing that we are seeing the overdose deaths significantly decline. We are also very conservative on who we send for autopsy. So that's the other thing. We're always keeping that in the back of our head too, because some families will request an autopsy when a person's died of natural causes, and we're not going to send them for an autopsy unless it's forensically relevant.
thank you. It's interesting. Lori?
Thank you. I'd just like to add to that, in that article, and in the national news, what was reported is one of the elements to the decrease in overdoses was a significant saturation of Narcan in the nation, which is also very relevant to our community. So we're seeing a correlation now nationally be reported of Narcan distribution and training and a decrease in our overdoses.
That's good to hear. Any other questions or comments from the committee or the board?
Move to approve.
That's motion by Supervisor Poole, a second by Supervisor Nordigian. Youth and Governance
Aye.
Committee, Aye. Any opposed? Motion carries for the acceptance of the Office of Medical Examiner.
Our next division is the Division of Veteran Services. Starts on page 201 in the budget book. For this division, we are looking for a levy increase of 40,000. The annual increase, including benefits, was 4,200. Medical insurance changes in coverage was 25,000. They did take some extra space in this building. They have an increase of 6,600. And we did increase in the Veterans Court. We had 2.5 participants budgeted last year. We increased that a half participant to 3, and that was an increase of 4,000. Questions on the Veteran Services?
Move to approve.
I just have a question before we vote. I had notated that the revenue had gone down. I was just curious as to why. For Veteran Services.
Their revenue was 14,324 and 14,325. So 14,300 is a state allocation that they give us. It's a grant that they give us. If you were looking at 2023 possibly,
Yeah,
I think they gave us a little additional stuff for the COVID ARPA stuff.
it was 33,800. Yeah, 33,478. Yeah.
Yeah.
Okay,
But
so
usually
that,
stays flat.
okay, so that was due to ARPA funding?
Actually, was that ARPA or was that just an additional?
Barney here?
Just,
Or Patty's?
the grant was increased just for that temporarily, for that 1 year.
Thank you. Any, there's a motion on the floor and I think it was seconded. Youth and Governance, how do you vote?
Aye.
Committee? Aye. Any opposed? Motion carries for the acceptance of the Division of Veteran Services budget. Yeah, Supervisor Robinson.
All right, the next division is our Division of Health Services. That starts on page 209 in the budget book. And it's on page 11 in the Human Services book. Their annual increase with salaries and benefits, not including the health insurance, was an increase of just under 42,000. Their health insurance, because of employee elections, was a decrease of just under 49,000. For funding changes, they have a public health infrastructure grant that was started in 24. And we have an increase in expense and revenue of 159,000, just under 160,000, as well as 2.0 FTEs increase. The health specific ARPA funding has ended. That's a decrease of 538,000 in revenue and 536,000 in expense, and a decrease of 2.0 FTEs. We have an increase from the state for the Nurse Family Partnership of 300,000, and that is to fund additional 2.0 FTEs in that program. We have a increase in expense and revenue for the HUD program. We have an increase in expense and revenue for the WIC program based on enrollment. We have an increase in Title 10 funding, 38,000. We have an increase in the lab and medical supplies for opioid remediation equipment of 55,000. We have an increase in the environmental revenue, 99,000. And we have an increase in, we have a new grant in the environmental for testing lead in the water. That's an increase in revenue of 24,000. We have an increase for another grant in environmental for tracking for 10,000. And then they also have an increase for urine analysis, interdivisional. They did a cost allocation and have an increase in what they're charging the other divisions. And that's for 74,000. We have a provider increase for fiscal services of 41,000. The city contribution, as we phase that out on what the city pays us, that'll add 100,000 to the levy. We have 4 more years after this one. They had a clerical error just from one account to another. And then we have an increase for software development upgrades for the Medicaid reimbursement and time tracker of 17,000. Questions on health?
Tammy, when we get the spectrometer, what do you foresee as how much savings that will be for the county? As opposed to shipping urine and, alcohol and, other tests to wherever. What do you foresee as a potential savings to the county? Maybe Lori needs to answer that one.
Yes, hi. What we see is almost a wash. When we did 2 years of tracking of it, we spent approximately $10,000 shipping the samples to Redwood Lab. And the variance in that is approximately 99, something very close to 10. So it's almost a wash.
But it's an increase in convenience and help for
Oh,
law
turnaround
enforcement.
time is the real issue.
That's the real benefit.
Yes.
Yeah.
The real benefit is we do not have to send out for any more confirmatory testing for the UAs for treatment court DCFS.
Supervisor Robinson, follow up?
Just President of Board of Health, and we've discussed on, it's on.
Oh,
Speak into it.
Okay, speak up, sorry, too short person issue, sorry. We discussed at Board of Health when we went over this budget that yes, the revenue is flat. It's the turnaround time and it's the fact that once we get all the systems working, we will be able to possibly have a revenue positive stream by, as we get our county, all of everything facilitated, we can then, look at neighboring counties who do not have access to this, and it may be revenue positive at that point.
And I forgot, that kind of reminded me, this was approved unanimously by the Board of Health, but we do have one modification that we are requesting for this budget. So, the modification is to increase the health infrastructure grant. Right now, what's in the budget that we proposed was 171,000, and we would like to increase that to 270,000. It's an increase in revenue of 98,759.
So it goes from 159 to 270, you said?
Correct. The full grant is 440,000.
That's the public health infrastructure grant under funding number 2, first line.
Yes.
And it's going from the 159,991 to 200.
No, I'm sorry. The 159 is with that modification that the Board of Health approved. So if you look at the levy decrease, it's 111,000. It does not match our budget book. The decrease originally was 12,000, right around 12,000. So this is with that modification,
Okay.
and then it will decrease their levy.
This is what you sent over second, right?
Yeah.
Okay. Okay, thank you.
One other question. I noticed in the revenue line item, you have tattoo and body piercing. Just for kicks and giggles, can you explain that?
I believe that's licensing for that, right? That's the
That's
license.
correct. We license those facilities, our
Oh.
environmental sanitarians do.
Okay, so the county's not giving tattoos and body, okay, all right, just wanted to
Absolutely not.
clarify that. Yeah, I had a question mark, so. Supervisor Poole?
Thank you, Mr. Chair. Can you elaborate on the Title 10 funding? What is Title 10?
I will give that to Lori.
That is our funding for reproductive health and family planning. It is a federal grant that is repurposed through the states, and we get that on an annual basis. We are funded through, we've been funded for that for several years now. And the allocations of that change a little bit from year to year, but it's for our clinic. And it basically funds staffing revenue for our, it basically supports our staffing for the clinic for that service.
Thank you.
Any other questions?
Yeah, I do. Mr.
Yeah,
Chair.
Supervisor Rodriguez?
Thank you, Mr. Chair. Lead and water testing, do we know how many homes we think are,
So that is not actually for the homes, it's actually for daycares and schools.
no? Okay, do we know how many daycares and schools we have to do any lead abatement on for, now this is just water, I understand, but.
Yeah, I don't know, so the testing is, I believe, 1,200 per facility. Yeah, 1,200 per facility. I don't know if we've had any test positive yet. Go ahead, Lori.
I think we have had one. I could be stand corrected, but most of them have been clean. And we have done 20 so far. That is a grant that we've had all of last year, and it'll be repeated this year as well.
So it's just testing, we're not mitigating anything, do we require the facilities to mitigate if that's the case?
We do get $1,200 from the state for each site to mitigate. Yes.
And what does?
I'm sorry, the state does the mitigating.
What does mitigate involving?
If we find lead in the water or lead in the pipes, the state provides the contractors to come in and replace the piping.
And we have to pay how much for that?
We don't pay anything.
Okay, so it's all.
We just do the inspection.
Okay, okay. And right now, we don't see a lot of them out there.
No,
And do we test every year, every one of them?
no, we don't test every one of them. We inquire if they'd like to be tested, and most of them say yes.
Okay. Okay, and then the next line down, new environment grant tracking. Is this the tracking that you were talking about earlier?
No, I have to actually find out what that is. It's something new that just that was just discovered recently with our environmental health manager, and I haven't had the opportunity, honestly, to discuss that with him. So it's not something that we've been approved to do. It's a possibility.
So we've got $10,000 that we're going to put into our health services budget, and we don't know what it's for.
That's my error of not knowing what it is this evening. I can easily find out.
Okay, thank you.
Have any more questions, Supervisor Nordigan?
No, thank you.
Oh, okay. Anything else? Committee or board? Any questions? Comments? Do I have a motion?
I move to approve.
Supervisor Kirby, do I have a second?
Second.
Second by Supervisor Nordigan. Youth and Governance, how do you vote?
Aye. Aye.
Committee? Any opposed? The motion carries for the adoption of the Division of Health Services divisional budget.
Okay, so for the next two divisions, as I said, in 2024, we split out behavioral health services into its own division. We did it starting September 1st, I believe.
Oh, thank you.
August 1st. But what I did for the budget for comparison is I split it as if it was split the whole 2024. It just made it easier to compare apples to apples. So you'll see in the budget book, you'll see aging and behavioral health have their own budgets for the whole of 2024, even though it wasn't effective until August 1st. And that's just so we can compare if it was the whole year, what our increases and decreases are from one budget to the next budget. So for the aging and disability services, that starts on page 219 in the budget book. And they are looking for a increase of 293,000 and an FTE increase of a 0.5 FTE. Their annual increase, including benefits, was an increase of 16,000. The home delivered meals assessment, we are requesting to bring, it was contract, we're requesting to bring it in-house. That's a half FTE at 25,000. For funding changes, we have a decrease in adult protective services, the state allocation of 14,000. We have a decrease in revenue for the resource center of just under 17,000 and a decrease in expense of 140,000. For the income maintenance, we have a decrease in revenue of 60,000. For the independent living support program, that grant is ending. This is a partial year. It's a decrease of 49,400 in revenue and in expense. And then we have the ARPA funding that has ended, 311,000 decrease in revenue, 38,000 decrease in expense. We have utilizing available trust funds, increase in revenue of 19,000 and a decrease in expense of 14,000. We have the long-term care administrative work that's been brought into house. That's a decrease of 15,000 in expense. We have the elderly and benefit specialist program. We RFP'd that program and we have a savings of just under 55,000. We have the goodwill increase for insurance costs of 24,000. We are requesting a 1.0 mobility manager. We did request a grant to cover this. We are still waiting for a response from that grant, but it's the 5310. That position would cost just under 106,000. If we get awarded the grant, that would be 85,000 in revenue, and it does have a match component, which is that 21,000. If we do not get the grant, we will not be hiring that position. The city of Kenosha is no longer going to be contributing to the mobility manager. That's a decrease of 30,000 in revenue. We have the behavioral health split. That's a decrease in levy of 74,000. We are budgeting some trust balances that we have. To increase in revenue 396,000, an increase in expense 445,000. We have an increase for senior nutrition food costs of 21,000. And then we do have a clerical error, which is just a reclass from interdepartmental personnel to interdepartmental charges for 30,000. Questions on aging and disability?
Supervisor Robinson?
Thank you. Could you explain to us a little more about the resource center allocation and why that has gone? What is happening with that?
So the resource center allocation is, the contract is over $1 million. I want to say like 1.2 million. And we are reducing it based on where our actuals are.
And that goes with income maintenance as well, right? Based on actuals?
Income maintenance, yes, it's, so the income maintenance program is actually in the workforce development. But as aging staff, if they're doing anything for them, helping, like if the elderly come down there and need some help filling out application, we can charge some of that time to the maintenance, funding source. And we're seeing a decrease in that activity.
Thank you.
Mhm.
Any questions? Any other questions?
Move to approve.
We have a motion, Supervisor Nordigian, a second,
Second.
second by Supervisor Robinson. Youth and Governance
Aye.
Committee? Aye. Any opposed? Motion carries for the acceptance of the divisional budget for Division of Aging and Disability Services.
I forgot to say that, that budget did get approved unanimously by the Commission on Aging and Disability Services on October 14th.
Thank you.
Now we have the new division, Division of Behavioral Health Services. For this, division, it starts on page 227 in the budget book. We are looking for a levy increase of just under 173,000. Their annual increase, including benefits, was a decrease of 7,200. We are requesting to add a 1.0 public safety social worker. This is the embedded social worker in the sheriff car. The expense increase is 135,000 with a revenue offset of 30,000. The behavioral health division split is an additional 171,000. For funding changes, we have a decrease for the substance abuse mental health ARPA supplemental grants. That's a decrease of 142,000 and also a decrease in expense of just under 30,000. Interdepartmental revenue for the opioid fund, the increase in revenue and expense, 162,000. We have a new Bureau of Justice Assistance, the All Rise grant. The increase in revenue, 493,000, increase in expense, 493,000. We are projecting an increase for the state opioid response grant of 25,000. And an increase in the intoxicated driver program of 21,000. The placements, we have an increase of 370,000. If you go to the next page, that will show our placements. 2024 over 2025. So for 2024, we had budgeted just over 6 million. And now we are looking to increase that to 6.5 million. And there you can see the days of care versus the rate and what makes up that difference of 500,000.
How many people are being placed?
So we budget by days of care. So in 2024, we had 24,000 days of care, and now we're dropping that to 18,600.
But it's not correlated to,
I can say, you know, it's about 51 people.
oh, okay.
It, you know, on average, it's an average. But that's not necessarily how many people, because some people might have stayed 30 days, some might have stayed 40 days, but the average would be 51 people.
Thank you.
And if we go back to the behavioral health summary, we have a reduction in the DA diversion program. We are gonna still offer the services, but through the comprehensive community services that is fully funded. So that's a decrease in expense of 91,000. We have removed out of the budget the behavioral health clinic funding. That's a decrease of 304,000. We have a reduction for the Behavioral Health Resource Center for just under 64,000. A couple of clerical errors. Again, the personnel expense to the interdepartmental expense for 30,000. And reducing the federal interdepartmental revenue and increasing interdepartmental charges expense of 222,000. And then the opioid funds, which is in Fund 210, we have an increase in the budget of 100,000. And we have also an increase for navigators for 162,000. And an increase for the lab supplies that I explained on the health budget for 55,000.
Yeah, Supervisor Nordigian.
Thank you, Chairman. Number 5, placements, you have levy increase 370,689, refer to the back page where the decrease is 470,689. Why the 100,000 difference?
So that's the DCFS Institute placements. So it is actually on the summary page as well. It's in the
Juvenile.
number 3 section. It's in, the Juvenile Institute.
Okay, thank you.
So we had to pick one or the other to put it in.
Half dozen one, 7 of another.
Oh, yes, sir. Supervisor Kirby, go ahead.
How do we come up with our estimated days of placement when we're projecting this? Because I know this isn't something we control.
Yes, we do base it on historical. So, we put these budgets together May, June. So at that point, we're looking where are we running, how many people? And then are we going to have any rate increases? So some is based off of historical projected rates, and then some are, okay, we know the state's going to increase their rates. They've already notified us of whatever the rate is, and both of those rate increases if we know them.
And so do you just use like the partial year or do you use like a rolling 12?
We project out. So we take the 2024, wherever we're at, and we just straight line it out.
Okay.
Any other questions or comments?
I move to approve.
Thumbs up. Their motion to approve by Supervisor Nez. Do I have a second? Second by Supervisor Robinson. Youth and Governance. How do you vote?
Aye.
Committee? Aye. Any opposed? Motion carries for the divisional budget of Behavioral Health Services. Are we done?
That's
I think-
that is it.
I was turning pages. I was like, what's next? Come on. Okay. So, any final comments by the committee or the board? Do I have a motion to adjourn?
Move to adjourn.
I'll second.
Second? Who was the second? Supervisor. Okay, there you go. Youth and Governance?
Aye.
Yes.
I just like to make a statement. First of all, first thing that I'd like to make, thank you for your support on both sides. We really appreciate your support. Secondly, I'd like to acknowledge Tammy up there. She did a tremendous job explaining this budget. I think we should all give her a little hand.
Yeah, sure. Thank you. Okay, so there was a second on the floor? Okay. Youth and Governance, you already, okay. Committee, how do you vote? Aye. Any opposed? I didn't think so.